Hello guys! Today we are talking about a really crucial topic that could save your life: recognizing the signs of cardiac problems. Did you know that something as simple as bleeding gums could be a red flag for heart disease? A study by the Heart Institute in Brazil revealed that a staggering 45% of heart diseases and 36% of deaths from heart problems originate in your mouth. But can you spot other signs that your heart might be at risk? If you think the signs of heart trouble are just chest pain and shortness of breath, this video is for you. Stay tuned to uncover the hidden clues your body might be sending. But first, like the video and subscribe to the channel. Let's aim to make this video the most liked one on the channel. Have you or someone you know ever had heart disease? What part of the world are you from? After you've watched the video, leave a comment below so we can connect and get to know each other better. Your heart, the never-ending engine of your existence, works around the clock to supply nutrients and oxygenate every cell in your body. However, like any machine, it might fail. Often, the warning indications are faint, disguised as common symptoms. That is why, in this video, we will show 10 major indicators of heart disease that can be fatal. Stay tuned to the end to see how something as simple as a cough or hair loss on your legs might indicate that your heart is at risk. 1. Frank's sign. Starting today, you may find yourself paying greater attention to people's ears. Doesn't it sound odd? However, a small feature on the ear may indicate a lot about heart health. It's known as Frank's sign, a diagonal crease on the earlobe that might suggest congested arteries in the heart or neck. It may sound incredible, but Dr. Sanders Frank discovered this finding in the 1970s after noticing it in several of his patients with angina or chest discomfort. But what is the link between the ear and the heart? The theory is that the same factors that damage arteries can also cause this crease in the ear. But don't panic. Not everyone with Frank's sign has blocked arteries. In around 70% of instances, this crease indicates a cardiac condition, while in the remaining 30%, it is simply a symptom of age. And the younger the person, the more likely it will be a warning sign. So if you or someone you know is under 40 and has Frank's sign, you should be informed and consult a doctor for a more comprehensive examination. Remember that Frank's sign is not a final diagnosis, but it is a valuable hint that should not be ignored. 2. Unexplained fatigue. Feeling tired after a busy day is normal, but what if that tiredness becomes constant and unexplained? If you're dragging yourself to complete simple tasks like climbing stairs or walking short distances, pay attention. Your body might be sending you a crucial warning sign of a cardiac problem. When your heart is weakened or enlarged, it can't pump blood efficiently to your lungs and muscles, leaving you feeling drained. This fatigue can be a symptom of various heart conditions, such as arrhythmias, including atrial fibrillation, heart valve problems, early-stage heart failure, and low blood pressure. 3. Loss of appetite and nausea. Loss of appetite and nausea are common symptoms associated with digestive problems, a stomach infection, or simply a bad meal. However, if the right side of your heart isn't working properly, your liver may grow or build fluid surrounding it and in your gut. This interferes with digestion, resulting in a loss of appetite, nausea, and in some cases, heartburn and stomach discomfort. So, if you have these symptoms, don't dismiss them as merely stomach pain. Your heart might be trying to tell you something. 4. Hair loss on your legs. Have you noticed if the hair on your legs is thinning? It might seem like just a cosmetic issue, but hair loss, especially on the shins and thighs, could be a red flag for a more serious problem: peripheral artery disease. PAD is like a clog in the arteries of your legs, preventing proper blood flow. Without enough blood, the hair follicles don't get the nutrients they need and eventually fall out. So, if your legs are suffering, your heart might be at risk too. Besides hair loss, other signs can indicate PAD, such as smoother and shinier skin, cold skin, and slower growing toenails. But hold on, not all leg hair loss means PAD. Genetics and even friction from pants can cause this problem. 5. Chest pain and palpitations. Chest discomfort is the most common sign of heart disease, and for good reason. It is frequently the first indication that anything is terribly wrong. Most patients with deadly cardiac problems suffer chest discomfort or tightness straight away. But here's the catch. The pain doesn't always remain put. It can extend to other regions of your body, similar to a distress signal emanating from your heart. Pain in your heart might impact your shoulders, arms, elbows, back, neck, jaw, and belly. And it isn't simply pain. Palpitations or irregular heartbeats are another key warning sign. You may feel your heart race, flutter, or skip a beat. These sensations can be frightening and should not be disregarded. 6. Swollen feet and legs. Are your shoes feeling tight or no longer fitting? Swelling in your feet and legs can happen for various reasons, including excessive heat. But when it's persistent, it could also be a sign of something more serious, like heart failure. Heart failure occurs when the heart muscle weakens and can't pump enough blood for the body's needs. As a result, fluid builds up, especially in the legs and feet due to gravity. 7. Constantly cold hands and feet. Cold hands and feet might seem like a minor annoyance, but when this sensation becomes persistent, it could be a significant red flag. Think of your heart as a central heater, distributing warm blood throughout your body. But when it's weakened, as in heart failure, blood is prioritized for vital organs like the brain, leaving your extremities, like your hands and feet, feeling cold. High blood pressure, another condition that affects the heart, can also cause this chilly sensation due to decreased blood circulation in the extremities. So, if you're experiencing constantly cold hands and feet, don't brush it off. A visit to a cardiologist can help identify the cause and get you started on the right treatment. 8. Persistent cough. A cough is like an alarm your body sets off when something isn't right. Usually we associate coughing with colds or allergies, but what if it persists for weeks with no apparent cause? In that case, the warning might be coming from your heart. When your heart isn't pumping blood efficiently, fluid can build up in different parts of your body, like your lungs, liver, digestive system, arms, and legs. In the lungs, this fluid buildup can cause a persistent cough, often mistaken for asthma or other respiratory conditions. This cough may be accompanied by wheezing, further confusing the issue with asthma or other lung problems. Enjoying our video? Before we continue, make sure to hit that like button. The more likes we get, the more YouTube will share it with folks who might not have easy access to doctors or hospitals. And don't forget to subscribe to our channel and tap the notification bell so you never miss out on our latest informative videos. 9. Cold sweats, excessive sweating, and frequent nighttime urination. Cold sweats, excessive sweating, and frequent nighttime trips to the bathroom might sound familiar to those with diabetes. But did you know they could also signal heart problems? While hypoglycemia, low blood sugar, is a common cause of these symptoms in diabetics, cold sweats and excessive sweating can also be signs of an acute myocardial infarction, or heart attack, an event that demands immediate medical attention. Moreover, the constant urge to pee at night, a classic symptom of diabetes, can also be linked to heart failure. When the heart doesn't pump blood efficiently, the body retains more fluids, which need to be eliminated through urine. So if you have diabetes and experience these symptoms, don't ignore them. Seek medical advice to investigate thoroughly and rule out the possibility of heart disease. 10. Unexplained weight gain. Gaining weight for no apparent reason, without changes in diet or habits, can be more than just an annoyance. In fact, it could be a warning sign of heart problems. When your heart isn't functioning properly, as in heart failure, your body may retain fluids because blood isn't being pumped efficiently. This fluid retention can lead to sudden and unexplained weight gain. If you notice weight gain without an obvious cause, especially if accompanied by other symptoms like swelling in the feet and legs, shortness of breath, or excessive fatigue, don't hesitate to seek medical advice. The cause could be your heart, and early diagnosis is crucial for treatment and preventing complications. As we've seen, the warning signs of heart trouble can be masters of disguise. They hide in plain sight, masquerading as everyday problems. A persistent cough you blame on a passing cold, unexplained fatigue you chalk up to work stress, or even those extra pounds you blame on lack of time to exercise. But what if these seemingly harmless symptoms are actually your heart's cry for help? If you lead a sedentary lifestyle, are overweight, have high cholesterol, diabetes, or a family history of heart disease, it's time to pay closer attention to your body's signals. Think of your heart as an engine. If it doesn't get proper maintenance, it can start to fail, and the consequences can be severe. But don't despair. The good news is that prevention is the key to a strong, healthy heart. Small lifestyle changes can make a big difference. What about swapping the elevator for the stairs? Replacing fast food with a colorful salad? Starting to walk for 30 minutes every day? And don't forget those regular checkups. Seeing a doctor and getting regular tests are essential for monitoring your heart health and catching any problems early on. Knowing your blood pressure, cholesterol, glucose, and triglyceride levels is like having a detailed map of your heart, allowing you and your doctor to chart the best course for a long and healthy life. Remember, 80% of cardiovascular disease cases can be prevented with prevention. Don't wait for your heart to scream for help. Start taking care of it today. So, did you know all these signs? When was the last time you had a complete checkup? Share your experiences in the comments and help others take care of their most precious asset, their heart. If this video was helpful, type yes in the comments, and don't forget to like, subscribe to our channel, and hit the notification bell so you won't miss any important content. Share this video with your friends and family. Your help could save countless lives. Have an excellent day and keep healthy, my friends. Until next time, bye!